I wanted to see what you guys see, but it took forever. Okay, so the atlas, remember the atlas, that's a globe. It rotates on its axis. So the atlas, like our head, will rotate. So that helps you remember that the atlas is C1. The pivot point is the axis. So that joint is called a pivot joint. You have 7 cervical vertebrae, 12 thoracic, 5 lumbar. Oh, look, I did my answer wrong. It should be 5 lumbar. I will have to fix that. The vertebrae that you had in the picture, it had a triangular shaped foramen, or did it have a circular shaped foramen? It was the lumbar. The thoracic vertebrae had points of attachment for the rib, but I thought I gave you cervical in the picture. Now I got to look at that again. Total of 12 pairs of ribs, and we have 7 that are true. The first 7 are true. The next 5 are false. The last 2 of those 5 are floating. And then the proper name for the sternum is the breastbone. Okay. Can we label this graphic? So this is what we'll want. So the vertebral foramen is the body portion, right? The big piece. The transverse process, the 2 that stick out the sides. The articular process stick above, up, superior, and down, inferior. And then we have the vertebral foramen, the hole in the middle. And the spinous process is the one that's sticking out the backside. So the blunt edge here, the triangular shaped foramen, that would make this a lumbar vertebrae. And we'll start with new information. So here's our target. We want to be able to label the parts of a long bone and maybe some importance of each of those parts, as well as a few bone markings. The bone markings we're going to cover are a condyle, a fossa, and a head. So head are balls, condyles are knuckle-like, fossas are grooves. And we'll describe 2 joints, the ball and socket, which you might already be familiar with, and the hinge. So these are the parts that we're going to talk about. We have a slide for each of these things. In the end, your task is to create a model of materials you can find at home of a bone and be able to, like, you want something that represents each of these words, okay? So we'll come back to that. So the diaphysis is the shaft of the long bone, the long part. So this is going to be my diaphysis. Dia means through. It's covered with a thin layer of fibrous connective tissue called periosteum. Peri means around, oste, bone, right? Eoms are typically tissues or linings. We're going to use that same nomenclature for every chapter. There's a perimysium, a periosteum, a pericardium. They all have that same nomenclature where the peri means around, the middle, the root is what it's referring to, and then eum is the tissue. So it's highly vascular, meaning it has blood vessels. So it has a good blood supply, and it's firmly attached to the bone. So this is where we find osteoblasts. That's a new word. You saw it on one of your worksheets, though. Osteoblasts are bone-forming cells. So remember we mentioned osteocytes, the mature cell. The blast is the one that forms the matrix that covers them, okay? We know that the wall of the diaphysis is compact bone. So you can see the shin splint right here. See the inflammation? That's the periosteum. So when we're talking about this outer layer, that's the part that's actually affected by the shin splints. So when muscles are imbalanced or overused, these muscles are attached to bone, right? And the muscles will pull on the bone, and what they're pulling on is that tissue. So that tissue becomes inflamed, it presses on nerves. That's the pain you're feeling. When this turns into a stress fracture, the periosteum is pulling on the bone tissue itself and begins to fracture it. So usually this is from like overuse or a change in training. Okay. So the other thing we want to label is the medullary canal or medullary cavity, either way. So inside this is basically a hollow tube. My mom broke her femur all the way through. They hammered a rod all the way down the center of this tube, 18 inches. So it's a hollow tube. That hollow tube is called the medullary canal or the medullary cavity. It has a lining as well. So you have the outer tissue, which is the periosteum, and then this hollow tube has a lining, the endosteum. So like if I had a straw and I lined the inside of the straw with something, that lining would be the endosteum, internal bone tissue. It's filled with yellow marrow, which has cells of red blood cells, and adipose, which is fat, in various stages of development. So I normally think yellow fat tissue is yellow. So that helps me remember yellow tissue is there. Red bone marrow is found up here and down here. And when you're a baby, you can find red marrow in here as well. And you'll remember we talked about hematopoiesis, formation of blood cells. So that's occurring in wherever you have the red marrow. So in babies, it's here. For adults, just up here. Epiphyses, epi means above or upon. And again, that term gets used in every chapter. So the epiphysis is above the diaphysis. You have a proximal, closest to the attachment of the body. This is my hip. Distal, the one that's furthest attachment. This is my knee. Okay. So here you can see the epiphysis is made of a separate tissue from the rest of the bone. So the diaphysis, the metaphysis, this is spongy bone, this is compact bone, right? So this is a separate tissue. And then it forms the articulation. Articulation means joint. So depending on the shape of the epiphysis, you can have different types of joints. So this particular one, we have a head. A head is a round-like projection. We have matching on the quiz, on the test, and you match the different descriptions to their terms. And it forms a ball and socket joint. So good examples, the proximal end of the femur and the proximal end of the humerus. So here you have the proximal end of the humerus making a ball and socket. It can go in all directions. The condyle means knuckle-like projection. So if you look at your knuckles, condyles have knuckle-like projections here. This forms a hinge joint. You have that in your knee and in your elbow. So at the end of the humerus, we also have a condyle. So the condyle is going to fit into a fossa. A fossa is a shallow groove. So you have this groove here, and you would have grooves here. So you have condyles and fossas. Here you can see the fossa in this image and in that one. So it's covered with articular cartilage. Originally, your whole skeleton is cartilage, and this is what remains of the cartilage as you get older. So that cartilage creates a smooth surface so that when you have movement at a joint, it's reducing friction. So as you get older, you start to wear down that cartilage, and that's where you start to get the aches and pains in the joints. The epiphyseal line you can see in this picture. So this is the whole thing is the epiphysis, right? So this whole thing is the epiphysis. It's covered with cartilage, and you have this epiphyseal line or plate, depending on your age. You've heard of your growth plate. That's your epiphyseal plate. So it's found in the epiphysis. So this is going to be cartilage of which you're going to continue to grow bone in a linear fashion until your older teens, early 20s. And then it will become calcified, and so it's no longer the epiphyseal plate, it's the epiphyseal line. So even in your older ages, you'll be able to see that line in, say, an X-ray or an MRI. Okay, so that's some features of the epiphysis. So here's a real quick, let's see if we can launch this website and practice the diagram of the long bone. So you can always revisit that site. Anytime we have labeling, you can throw a search in there. You'll find all kinds of examples for that. Okay, so we have talked about all of these pieces. I went kind of quick, tried to show you what they look like. You'll get a better idea after you put your own together. I wanted to get an example out, but it's in a box. So here's what you have is a checklist. So when you make your model, you want different tissues for each of these things, and use this as a checklist to make sure you have them included. You're going to make a video. So you're going to describe to me your model. You'd be like, this is saran wrap. I used it from a periosteum. It's the outer tissue, outer layer of the bone. I can repair bone from the periosteum or something, you know. Talk about each of your things. You don't have to label this, but that's just a graphic to help you remember. In the Google Classroom, I also put a coloring sheet, and the coloring sheet is just for your own good. It's nothing you have to turn into me. The model, the video, that's what you're going to turn into me. I didn't know, maybe that coloring sheet was helpful to you. So this is where you will get that checklist, and you will also turn in your video. So upload your video here. So it'll be an attachment. A lot of kids struggle turning in their videos from their phones. So if you have a problem with that, put it into the Google Drive first. Don't email me a whole bunch of links. If you put it into the Google Drive, you'll be able to then upload it from the Google Drive or just like link it there. It does whatever it does on its own.